One topic that is top of mind for everybody right now is cybersecurity. So in healthcare, we had 2 big recent cyber attacks, and everybody's dealing with concerns about this. What advice do you have for our customers?
Okay, so cybersecurity incidents are almost always human error. I hate to say it, we all love humans, but as you know, humans make mistakes. And I'm not even saying things like they put a sticky note with their password and things like that. They just make even configuration mistakes, setup errors. They literally leave doors open. Because the reality is that any operation that is currently running their own systems also knows that they are connecting in the back with a whole bunch of others. And the way cybersecurity vandals, criminals, bad actors work is often, it's not that they're brilliant. Your system is really a chain with many, many links. And the bad actors are just looking for a weak link. They're just looking for an unpatched system, a misconfiguration, an error. Now, for us at Oracle, security is so ingrained and fundamental. Because I mentioned, our first customer was the CIA. They marvel at how insanely paranoid we are. So when we built our cloud, we built it in a way so that our customers, when their workload is running, our network is running on a completely separate set of processors so that you are never at risk, customers never at risk from what we call a noisy neighbor or a noisy neighbor. So noisy or nosy. They can't take a free ride. They can't look in. And additionally, we've implemented such deep AI. Again, why? To avoid human error. On the next level is autonomous database. Again, why is it autonomous? Because it is constantly under attack by robots. And humans cannot fight robots. Only robots can fight robots. And again, every single thing we do is focused on security. After one of the hacks, one of the very significant hacks that I know impacted quite a few of you on one of the insurers, they came to our cloud because they realized there was simply no way they could defend themselves against what was going on out there. And it's not only in the healthcare industry, the utility industry, the retail industry, the telcos, and the banks. They've all moved in. Why? Because they simply cannot protect themselves. They have to have someone whose whole job is to secure them. Because again, you are at the risk of that one weak link. Unfortunately, if you're not in a secure cloud, they're going to find it, unfortunately.
So you mentioned the cloud,
Yep.
and I've now been at Oracle long enough to know it's not the white fluffy thing outside. But for our healthcare folks out here, explain the cloud and why cybersecurity and why it's important to what we're doing in healthcare.
Okay. So, why the cloud, right? Why all of a sudden it's gotten so fashionable? Well, because you see, the same lesson I learned at Oracle when Larry and I did that first transformation way back in the turn of the century, actually. Right then, what we realized is when we brought all our disparate businesses together, we removed duplication and we benefited from economies of scale. Okay, well, you know what the cloud is? You not only benefit from our scale when you come to us, the economies with Oracle, but the economies of scale of all our customers. I would challenge you to ask some of your technical people, what is the utilization of your data center? I can tell you, when we asked that exact question at Oracle, the first time we asked it, it was actually in the single digits, because the secret of tech people is they love having extra capacity just in case, right? Now, of course, you're paying for all that extra capacity. What's wonderful about the cloud is the cloud has extra capacity, but you only pay for what you use. It reminds me of someone in a completely different industry. I was talking to the CEO of Uber, and they were basically on-premise. They're a tech company themselves, right? And they were running, and remember, there was a time, I guess it was during COVID and during other parts, where you didn't even have to be profitable, and you still had an enormous market cap, not even profitable. And all of a sudden, as do all good things, it came to an end. And they felt incredible pressure to save money. And they benchmarked us against our competitors. And they brought the bulk of their workload to us, and all their new workload to us. And I can tell you, when I saw Dara talking on CNBC on their first profitable quarter, I just am listening to him on CNBC, and just a little smile came to my face, because I knew that they had saved an absolute fortune by just participating in the economies of scale. But I'll tell you one other thing that he said, and I think it is one of the things that makes us a bit different, is that he said to me, and I think this is the best thing anyone has ever said, we partnered with him and with the company so closely that he couldn't tell where they ended, his staff ended, and our staff started. And it sort of brings me back to our whole feeling of being in healthcare, because I think one of the most important things Larry said about our move to healthcare was, we are doing this after decades, after building every single piece of the technical platform that's necessary. We are doing this like we did during COVID because we could, but we can't do it alone. That it has to be in partnership, in the ecosystem, in the partnership with the other technology and other medical companies, but even more so, in partnership with our customers. That's where we really shine and we learn.
So in the time that I've been at Oracle, I've heard you talk a lot about customer service. And this morning we talked about the brand new Oracle EHR. And so I know there's a lot of questions from our customers, and sometimes it can be intimidating to think about a new EHR and an implementation. Share with the audience sort of your view and what they can expect from Oracle, and kind of what you ask your team to do.
Well, you know, one of the things we learned during COVID, but even during this process since we merged with Cerner and really started to learn from our customers, is we realized that so much of what EHR had turned into was basically a giant documenting system, billing and documenting, and that physicians, physician assistants, nurses, instead of getting to do what they love, which is helping patients and learning and thinking about how do I help these patients who are in distress? How do I view their situation? They end up spending all their time typing, billing, and even in days where they spend as much of the day as they can with patients, they end up spending their nights doing paperwork or typing. And we realize that we have to turn this entirely around. Instead of putting data into the systems, and I'm sure Larry will talk a little bit about the new AI EHR systems, where really the data goes in, and ultimately the data in the system is used to help doctors and nurses and PAs help their patients. Instead of data in, having the data there so that they don't have to think about just the experience they've had with the one patient. Can I give you an example?
Please.
So, this is a little bit of a personal example, but I'll explain. My brushes with healthcare have always been incredibly lucky, and I'll give you one of those lucky moments. All of a sudden, my optometrist looks in my eye and she says, the back of your eye is supposed to be smooth, but it isn't. It has all these bumps. Some of you physicians, especially ones who are ophthalmologists, you probably know what that's going to mean. Well, what did I have? I had a tumor, a meningioma on the entire optic nerve between my brain and my eye, and it was coming all the way through the back of my eye. What luck. Listen to this. I go to UCSF, and I end up having a doctor, by luck, who had actually had a patient with the identical thing. And because the previous patient, had done the research, he found a type of treatment that would kill this tumor completely surrounding the optic nerve, but not kill the optic nerve. Now, lucky me, I'm not blind in my eye because of that treatment. But you see, lucky me. But what about all the other patients in the country and the world who aren't that lucky? Wouldn't it have been good because no other doctor would have found this situation and that exact treatment. And it's just one of those things where we want to be able, when a doctor when the system knows the situation, to have it recommend what are the options and what are the outcomes for the different options. Because you could have just straight radiation. I had proton beam therapy at Mass General all the way across the country. Again, lucky me. But again, in each one of these cases, let's have the systems help the doctors, instead of the doctors be sitting there in their pajamas every evening after dinner, putting in billing codes. That's really what we want to do. We want everyone to have the best outcomes. I'll tell you, we did this in accounting already, okay? I told you the story of how I started, right? Finance in accounting, what did they used to do? It's like they were in a car looking backwards. They would document what had happened. That's not how finance works now, not using Fusion. Finance is actually the navigator for the business, looking forward and advising. We've done it for finance. We've done it for supply chain. We've done it for HCM. We've done it in many, many industries, banking, retail, utility, basically a dozen other industries. Now, we decided, shouldn't we use that incredibly secure, incredibly fast technology? Shouldn't we use it for something a little more important? Like saving lives? I think it's time. That's what we're here to do.
That's great. I was going to say, my question was for you, was what does it look like in the future? But you kind of described that, right? You talked about better outcomes. You talked about a better experience for providers, nurses, and doctors. And you touched upon the fact that this isn't the first time to the rodeo for Oracle. You've done this transformation before. But how do you think healthcare will be different? And what is this going to look like?
Well, listen, think about all of the advances just in the past 2 years with AI, with large language models, with machine learning, all of these capabilities. We're doing things in security, which will enhance privacy. We will allow data to be shared, in some cases anonymously, in other cases so that, God forbid, Larry gets hit by a bus. When he pulls into the hospital, they'll know everything about him, even if he's never been there. And that's how it is. You will show up, they will see you, and all your data for your healthcare, and it's your data, of course, will be available for the physicians and the nurses that you choose. And they will be able to treat you holistically. They will be able to be the doctors and nurses that they went to school to be, instead of what is burning them out right now. And they will have the same tools and better tools. I find it insane that shopping is so easy and shopping is so perfectly aligned for what you want and what you need, and yet healthcare, one size fits all. You show up and you start filling in forms. Really, every time. That's not how it should work. Your health should be at least as important as your shopping journey.